anyone missing a baby?
Anyone could come and claim it.
Baby Jane Doe?
Got mine on my first try.
Well, way to go, babe.
Never met a peds nurse yet that wasn't a little wacky. You know what 12 hours of crying babies does to a person's psyche?
I disagree. I have feelings about many things. The size of things that come out of places sometimes is a little surprising.
I can agree to that, yes.
Okay.
You know how to check a rectal temp on an infant?
I have to tell this joke.
Oh, no.
Hello, welcome back, and welcome to something new that we are trying on this channel.
Yes.
Reacting to medical drama TV shows.
Yes. So specifically, we're watching the biggest hit medical show of the 2020s, and that is HBO's The Pitt.
Yes, starring Noah Wiley, who previously played another doctor on a super popular medical show that...
Like when we were kids, yeah.
We're old, sorry. Growing up watching ER in the 90s. The Pitt takes place at an emergency department in Pittsburgh. It is supposed to be pretty dang accurate as far as medical TV shows go. But the bar is pretty low for that, though.
Fair.
We see you Grey's Anatomy, so we'll see.
So interestingly, neither of us have seen The Pitt ever. Heard actually wonderful, great things, but haven't watched it yet. The other thing, so obviously neither of us are emergency medicine physicians, but they do have these plots that are related to our field, so ObGyn and peds, and so we thought it could be great fun to watch those and see what we can learn. We're starting with the first 3 episodes of season 2. They don't really have any ObGyn related plots so far, I guess, but there are a couple of great peds cases.
Yeah, so if you're new here, we have been sharing our lives over the past few years as we've gone through trying to conceive, pregnancies, raising our now 3 kids. If this is your first time, I'm Kurt. I'm a board-certified pediatrician.
I'm Sarah. I'm a board-certified ObGyn.
And we are the Doctors Bjorkman.
We have a situation.
Excuse me. What kind of situation?
Someone left a little baby in the restroom.
Starting out, abandoned baby. Did you ever have any issue with that?
I have not experienced this exact situation. I think if a nurse comes to interrupt you as the doc in a visit with a patient, it is a big deal.
Also just as a resident in general, and like as an attending even more so, if the nurse comes in, you're like, okay, my ears are up. People don't just interrupt for no reason. So, okay, our attentions are up, we hear the baby crying.
Is anyone missing a baby? Did anyone leave their child in the restroom?
This like announcement of is anyone missing their baby, I feel like is like something that we're at risk for now that we have multiples. Like,
yeah,
where did Hank get off to?
This little baby is not a mobile baby who like wandered off. And I feel like if someone found a baby, there's always a code. You call a code.
Yeah. Oh yeah. There's definitely like codes. There's like, you know, code pink is generally like the hey, there's someone giving birth outside of the labor and delivery.
Code
Every hospital
silver,
has
somebody took a baby. There's different codes.
Color codes for each hospital that sometimes you'll hear. But like,
so
just like over the loudspeaker of, hey, is someone missing their baby? Like, oh, someone's got a bunch of them, or...
Yeah, I don't feel like you'd ever say that because it could, anyone could come and claim it.
I mean, you'd have to have some...
I know.
Here with a baby, but leave without one? No, sorry. Might be on the security tapes. I'll have them out, check it out. Please, yeah.
Also, can we just comment on how, like, this, like, baby phase of, like, they're just, like, happy being swaddled and held? Thank God for those moments, because there's a whole lot of moments where they are letting you know that they want to be fed, changed, or they need to go to sleep.
Right.
Okay.
They happen to find the, like, cutest, most pleasant baby.
Yeah.
In the bathroom.
I bet they just fed it.
Practitioner, this is Emma, new grad nurse.
Hey.
Nice to meet you. What's going on?
Somebody dumped their kid.
Maybe mom just stepped out for a smoke or something. What? I'm being helpful. Sometimes they just need a little break and then they come back. At least I didn't leave her in a suitcase at the bus station. Does that happen?
If that's a true story, I don't want to know about it.
This, like, sometimes families just need a break. 100% hear that.
Yeah.
Like, this is the, like, one of the things that we give counseling when a baby goes home from the hospital for the first time. Like, hey, if you need a break, A, put your baby someplace safe. This could be in a crib for 5 minutes. To take 5 minutes for yourself. Not a bathroom in an emergency department.
Right,
But
and this nurse is saying, hey, she's trying to give her the benefit of the doubt here. Maybe mom needed a minute. She left her here. She's going to go collect herself. She'll be back. Let's just give her a break. Parenting is real tough.
So hard. But there's a right way and a wrong way to say, hey,
I need
having
help.
trouble
and
caring
this
for
is
this child.
hey, this is a big way. Most states have places where you can leave a baby, a fire
Safely,
station,
yes.
different boxes, things like that.
Yeah,
So
like-
here, where leaving a baby in a hospital feels like a safe place.
Maybe.
Maybe.
There's definitely less danger than in a suitcase at a bus station.
Sure.
I'm a new dad, remember?
He's a new dad. He's like, let me snuggle.
So what is this, like, this place they're putting the baby here? This is classically called like a giraffe bed. It's got the big heater over the top. If you are going to deliver your baby in the hospital, often like this is where the baby goes for that first nurse assessment. There's a warmer. You'll see on the back of that, there's all these tanks that you can like deliver oxygen and positive pressure breathing if they needed CPAP. There's all the drawers that have a diaper and a swaddle blanket or like suction bulbs, things that like baby's gonna need kind of for that early resuscitation. In the ED, it might be a
I was
little
going
bit
to say,
different.
do they normally have those in the ED?
Not often.
Okay,
They have
it's
those
like
in the ED,
definitely
just
not
saying.
in an adult ED.
Yeah.
But, we've moved to somewhere now. There's a sunshine on the wall. And so,
They're ready to care for this baby.
They are.
They are ready. You've got the new dad, NP, who's so excited and like feeling all those feels. Like, gosh, why is my heart growing so much for just like everything little that squeals? So,
Yeah.
anyway.
I'll get Robbie.
Should I come with?
No, stay here. Donnie, Jesse, teach her something.
You know how to check a rectal temp on an infant?
Theoretically.
I have to tell this joke.
Oh, no.
This is my like first ever shadowing experience in an emergency department as like a sophomore in college undergrad. There was like this moment where they're like, hey, like you're just there, you're shadowing, your job is to like fill up the ice waters and just like watch for what and help whatever. And one of the nurses or techs who was there held up the thermometer and had a blue side and a red side. He was like, hey, you know what the difference is between the blue and the red? And I said, no, what's the difference? And he says, flavor. Classically, the colors were color coded. One is an oral thermometer and the other one was for rectal
Flavor.
temperature. So anyway, the like kind of like joking and playing on the youngest member of the medical staff, all in good fun, but helping to learn. Definitely, flavor is only one part of the difference between the red and the blue side of the thermometer in
Goodness
that ED.
gracious.
Okay.
Oh.
Yo, Rabinovich, somebody ditched a bundle of Joy in chairs.
How old?
Couple months maybe, Donahue's got her in peds.
No one saw who left her?
Apparently not.
It's so sad.
Tell me about it. Who throws away a perfectly good baby?
Sats, 99 on room air, normal BP, normal pulse.
This is like just like the challenge of pediatrics in pediatric medicine was shocking as a trainee. It was like how much struggles there are in childcare and like the amount that as medical providers we get involved with the social system and how do we help people, like the amount of families that struggle to care for children or struggle to support them or
And the
have
bad things that happen
and
to kids.
and absolutely bad things that happen
Yeah.
to kids. Like there is
It's tough.
an insane amount of tragedy, and so not that anything bad has happened to this child that we know of yet. Trying to figure out, we're gonna learn soon, I think. But like, man, if you're having trouble caring for your kids, please reach out,
Yeah.
find help.
Call your OB.
Like,
your OB, your pediatrician.
call
Yeah.
anyone. Figuring out first initial survey of this
Well
baby.
hydrated.
No obvious source of infection. Could be a benign virus, but can't assume that.
This is the abandoned baby?
Mm-hmm.
How old?
How old do you think she is?
Month and a half?
It's tricky.
What do you think, Doc? Do you think that's a month and a half old baby?
I don't know. I'm bad at this game. Like, baby's pretty alert. Like, definitely not a
That-
newborn. That baby's big.
That's a chubby, sweet little baby. That is not.
Yeah, I think 2 months. 2 months would be my guess.
Maybe even 3.
Okay.
I
yeah.
like a month is fresh. The rolls there are not.
Yes.
It's tricky. Under 28 days is a safe haven drop-off, no questions asked. But over 28 days is a crime, child abandonment.
How should we assess?
Under 28 days gets everything, including an LP, but over 28 days, you can follow PCARN or step-by-step to determine risk of invasive bacterial infection.
This baby looks great.
So they were talking about like the workup for if baby has a fever, if they're sick. And honestly, the literature on this and how much testing has to be done has changed a ton in the last 10 years alone. 10 years ago, kind of as we were just going through residency training, it was like, hey, baby shows up in the first month of life or even 2 months of life, they have a fever. It's, hey, we need to get blood cultures, urine cultures, and do an LP, a lumbar puncture, and take fluid from the spinal fluid to look for a serious invasive bacterial infection. We have algorithms and new data that says, hey, we can do some other testing, like getting a blood test for checking their blood counts and checking inflammatory markers like procalcitonin that can sometimes say, hey, baby's well and these markers are low. We maybe don't need to do all of that invasive testing. We definitely probably don't need to do a lumbar puncture in a baby that's well.
An LP is a big deal.
It's a big deal.
It's like a needle, big needle in their spine to get spinal fluid. It's painful, it's uncomfortable, it's also a risk of infection or other things. And so.
And honestly, in the last 10 years, I think procedural comfort is decreasing because it's something we do less common. It's a procedure I did a ton in training, but now I know our current residents, because it's not needed to do, and we have all this data to say, hey, we don't need to do this as often as we used to.
I remember when Kurt did his first LP in residency, his chief resident got him a bottle of champagne because it was his first champagne tap, meaning...
I was like, as you like go to place the needle, if you like nick anything and there's any blood, there's like, are there red blood cells? Are there white blood cells? And there's this classic, like, oh, you got a perfect lumbar puncture. It's just cerebral spinal fluid.
They call it a champagne tap.
Because it looks like champagne colored. And so like kind of the classic like senior resident buys for their baby intern when they get their first perfect tap. Yes. So I got mine on my first try.
Well, way to go, babe.
We know nothing about the birth history. Did mom have group B strep, active HSV lesions?
We should assume the worst. Put in your orders, Dr. Mohan.
CBC, blood culture, chem panel, chest x-ray, UAN culture, respiratory virus panel, check inflammatory markers, procalcitonin and CRP, then take it from there.
Big workup. Again, this baby is pretty well appearing, at least from what we can see. This is probably a healthy baby in real life. Would you do any evaluations? Some of that is like, hey, how do we have to make sure they're safe? The one thing they started out by saying are, what are their risk factors? What are the risk factors of a newborn who's had no care after birth? Honestly, I'd think about congenital heart disease screening, all of the other newborn things. Have they had their vaccinations that we think help make them lower risk? Or for a baby that's maybe really high risk for things like hepatitis B, if like we have no clue.
They mentioned HSV, so if mom has active herpes simplex virus, that baby can contract that as they're coming through the birth canal. They said, hey, we kind of have to assume the worst. This baby's been exposed to everything. Let's make sure we're keeping this baby safe, which seems reasonable.
Maybe. They're doing a lot of testing for a baby that like has normal vital signs and looks well. Otherwise, I don't know that you'd necessarily get a chest x-ray and inflammatory markers, but maybe we're going to learn something's going to happen with this baby.
Dr. Robbie, Santos needs you, North 1.
Okay, I'll be right there.
How's she doing?
Seems happy enough. Yeah. Hi. Just got a quick point of care CBC.
So point of care testing is tests that happen very quickly, kind of at the bedside. You don't run them through the big main lab blood analyzer, all the fancy things. There are certain things that you can get back quickly at the bedside.
The other thing that I think was interesting too, like Dr. Robbie got called away again, and something that happens, task shifting as a provider in the ED is something that you just have to get so good at, because there's so many different things and you're always triaging, hey, what's urgent? What can I like go away? Now there's an NP and another physician with this baby, like absolutely, like he says, hey, this baby looks stable. I'm gonna go somewhere else. Yeah. Like, which level are you at? Are you the frontline provider, or are you the attending who's overseeing multiple patients? And just like that task shifting that happens all the time in medicine.
If you are a medical student or someone thinking about going into medicine, that's an ED thing. Does that bring you joy? Is that something you like, that fast pace and doing 17 different things at once? I know as an ObGyn resident, we had to do 2 weeks in the emergency room. It very much confirmed I had made the right life choice. Yeah. Like, it's great, but it's just it's a totally different
and every specialty has different levels of that. Like if you're a surgeon, you're operating in the OR and then you get called about your patients on the floor, or like, you know, I'm a pediatric cardiologist. I've got patients in 3 different ICUs and on the floor, and I've got a patient who knows me from outpatient clinic that's calling with an issue. And so there's a little bit of that.
Yeah, most specialties you deal with the ED in some way, shape, or form, or the ED calls you for help.
Is there a problem?
Probably by this point, do you think they would have called peds consult, called like social work, called?
Yeah, I would assume they would have the pediatric hospitalist or a pediatrician come and evaluate the baby, to have like a pediatrics expert coming to see this baby. Because it's amazing how many things, like babies and children are not just small adults. Like it's just, they're different.
Did I miss something? Dr. Al? Dr. Al?
something's off with the CBC, the complete blood count. So either the baby has really...
Do you think it is something with the blood count, or is she going back to something that's her
Oh, I don't know.
trauma?
We're gonna find out. I thought this was something's off about...
See, I don't know
the characters, but
right.
I'm assuming there's something wrong with the blood count. Either it's really low and the baby's got some terrible anemia.
Or it's really high, and that's a big red flag for
cancer. Yep, absolutely.
Yep.
More labs are back on our abandoned Baby Jane Doe. Everything looks normal so far, but you seemed really concerned earlier.
She still needs a catheter urine.
Or not.
You can't trust a bagged urine.
Agreed, but we can avoid the trauma of a catheter.
With a suprapubic tap?
Oh, I may have a trick or two up my sleeve, Dr. Al-Hashimi.
Okay, we're gonna talk about this quick. So they're like,
attending drama.
How much workup do they need? They were talking about how do you collect urine from a baby, and this kind of comes back to if you're doing this infectious workup. Does my baby have a urinary tract infection? How do you test? And there's a couple different methods. So they talked about a cath urine. So the most perfect specimen is actually placing a little catheter, a small straw, through the urethra.
After very carefully cleaning off the urethra to make sure there's no bacteria there.
So that you get urine directly from the bladder through this catheter that's coming through the urethra into a collection bag, so that there's no infection like outside, like, oh, there's bacteria outside on the urethra. They talked about a bagged urine. They've got these little special plastic bags that have like tape that you like tape around. They're like either around their labia or the penis to collect that, but classically they just always get poop in them too, and then they're infected. There's other times where sometimes like
not infected, just dirty.
Dirty, yeah. Like because you get the bacteria from the poop,
right,
of course. Or other times like, oh, we're gonna put a bunch of cotton swabs in there and collect those, and then it keeps it kind of more in the front, and then you can get enough urine out of those to test again, like as long as everything's sterile otherwise, and the diaper can sometimes work. And then they talked about a suprapubic tap, which is pretty rare to have done, but honestly it's a really straightforward procedure that's relatively easy, that just like feels a little weird, that you take a needle just above the pubic bone, the bladder sits right behind, and as long as baby's got a full bladder, you can advance a needle right there. It goes through the muscular wall of the bladder, and then the needle closes up, and it seems really invasive, but honestly in some ways is way less invasive than a catheter. If you asked about that for your own child, you'd probably get told no, just because I think it feels a lot more invasive than using a catheter.
Totally.
I remember being a resident in the NICU, and it just like felt like way easier, because like a urethra, you can do damage to it just like, for me, like you could do damage to your urethra passing the catheter, or I could place a small needle, just like.
But it's still.
Yeah, most providers
like the risk of infection. Any ideas on which would be worse?
I imagine it's lower with the suprapubic tap.
Think so.
Oh, I do.
Interesting.
Okay, anyway.
Cleaned and dried with sterile gauze.
Is that water cold?
Right out the fridge.
Okay, Jess, you can take the armpits. I'm gonna take the legs. 1, 2, 3, up. Dr. Al-Hashimi, you're gonna be our catch.
This is fun. Okay, so he's got cold water straight out of the fridge. Like, how do we get baby to pee?
He's just gonna try to get him to pee and then catch it.
Okay, this is like both the nightmare of early dad stage and also the expertise of dad of 3 now. Every time you open the diaper in your baby for the first time, the cool air hits them and then they pee, and I can't tell you how many pee accidents I had around diaper changes with our first. Now with babies number 2 and babies number 3, when they're little and I'm going to change their diaper, before I'll take the diaper off, I'll take that wet wipe and I'll wipe it just to like
cold.
Like that cold wet wipe just above the edge of the diaper, just inside the diaper, and that cold reflex often will make them pee one more time before I open the diaper, and has saved me so many times from getting peed on. Like one of my little like expert pearls of diaper changes is actually doing this before you change a diaper.
Yeah.
And Samir, you're gonna do suprapubic circles with that gauze. And the cold should stimulate voiding.
Even if she pees, it's likely to be contaminated.
Not according to the British Medical Journal. They did the research.
Any lukes or nitrates, and we
love the humor.
Dr. Al-Hashimi, get it. I was going to invite you to join the softball team, but now I'm not so sure. There we go. Looks like you got a good midstream sample.
I have to say the dad jokes here are awesome. Anytime there's time to offer a little humor in sometimes tense situations, especially, the ED is famous for dark humor, but making appropriate humor to lighten sometimes stressful situations.
And because these two clearly have a little bit of a style difference in how they approach things. She seems to be very like
by the book. But he was up on the research, so.
The research?
I don't know if you caught the joke.
I didn't till right now.
The research.
Ceftriaxone 2-day admit till blood culture is negative.
Next steps.
Foster care.
Oh, yeah. Someone must have been in a bad way to walk away from you, little one.
We need to call the police.
Let me know what the urine dip shows.
Would you just culture for infection? Do you do a drug screen on that? What do you?
Absolutely, probably think about a drug screen. You know, the like workup for infection maybe was necessary, maybe not. But like Dr. Robbie,
Dr. Robbie.
Noah Wiley's character here, like addressing humanity as medical providers. If we fail to, medicine is not just pathology. It's not just things with the body going wrong. It's so like our bodies are connected to who we are and the situations we're in. And so in terms of like process, like the social worker needs to be there, child protective services, likely the police are getting involved too. They're expecting this baby is over an month of age. My guess was 2. So
well, what the age it is in the story is maybe different than the little baby actor they hired to do it, but
we'll see.
We will let you know what the urine dip shows.
I did, however, get a few things back on our abandoned Baby Jane Doe.
Still not me.
I'll take those.
Just keeping you informed.
Okay.
I think it's interesting they keep calling it abandoned Baby Jane Doe, like kind of like this term. I don't know, like sometimes that's easy to put labels on names, but I think that's something that we would work hard to like, you know, like a lot of times a baby or a child or someone comes in from a trauma, they get assigned a name or a tag, but like sometimes the monikers the little nicknames we give like carry weight. And maybe I would encourage people to say like, hey, we're gonna call this Baby Jane or whoever, you know, rather than the abandoned baby, the abandoned baby, the abandoned baby. I don't know, something I would have feelings about, but I have feelings about many things.
Baby Jane Doe? Yeah. She's looking good. She's looking good, taking formula well.
We're just trying to get her upstairs. Okay. All right, got it.
Super baby's urine dipped negative, 0 WBCs, respiratory panels positive for rhinovirus, giving us a benign source, procalcitonin CRP are pending.
Now, Peds is saying they want a urine tox screen and an HIV antigen before they'll take her.
That sounds excessive.
Absolutely, urine tox, not excessive. Testing for HIV, you know, I think this is like, what is baby exposed to? You assume no prenatal care. Testing for HIV, testing for hepatitis B, like some other things that we have treatments for, that early treatment matter. You'd have to think like, hey, sometime in the near future, this baby should get a newborn screen, a blood spot, congenital heart disease screening, all of those things. There is some things that definitely I don't think would be excessive. Other thing, in terms of the results that just came back, rhinovirus is one of the most common causes of common cold. Rhinovirus. You know, we see it in the wintertime all the time because our, you know, it actually survives at temperatures just a little bit lower than our normal body temperatures. And so as we're cold, it kind of makes it easier for them to replicate in our moist mucous membranes of the upper airways. And then the inflammatory markers are still pending.
Yeah, it doesn't feel like overkill. You don't know anything about this baby or where it's been or what it's from. And like
blood cultures and antibiotics for 2 days is a safe thing. I think many pediatric providers would do that. They said ceftriaxone is kind of common first-line antibiotics. Watching blood cultures. Again, how does blood cultures, how do they work? Well, they sample the blood and then they take a little bit of it and they put it on a plate that's specially designed to help bacteria grow. And then they watch it. They actually have kind of lasers that are watching this culture continually. And if there's no growth, by most time there's bacteria in the blood, it will grow in the first 24 hours and almost always within the first 48 hours. Standard is to watch those for 5 days in the lab, but you maybe could discharge the baby at 24 to 48 hours if there's no growth and all the other markers come back negative. And they've got a positive source for this baby's little symptoms. He's got rhinovirus, common cold.
You don't think the antibiotics are overkill? Totally asymptomatic, normal.
It sounds like he's got some symptoms. I think it's you don't know. I think some people would say absolutely treat this baby. Some people would say no. I'm on the fence. I'm going to let Noah Wiley make that decision.
They're just trying to keep her down here.
Can you blame them? Never met a peds nurse yet that wasn't a little wacky. You know what 12 hours of crying babies does to a person's psyche?
I need to pause there. I'm sorry for my laughter there about never met a peds nurse that isn't a little wacky. I disagree. You guys are all wonderful. I'm so thankful for all of our pediatrics nurses.
But each flavor of nursing, ER nurses, OB nurses, postpartum nurses, NICU nurses, peds nurses, definitely all.
There's like personalities that are drawn to each one.
Each specialty,
and there's
certainly
a skill set and a lack of skills that each one has too, kind of like we are as in physicians. Like if you ask me a question about the teeth or the eyes, you're asking the wrong guy. The nurse on a peds floor is very different than the nurse in an adult ED. And like, you know, it's just like different. And they're going to say, hey, like I will say no one is more protective of their patients, and rightly so, than a NICU nurse. Like, God bless all the NICU nurses. You guys are amazing. And pediatrics nurses are also, when
they're just mama bears. That's their patients, their kids.
Absolutely.
You know, they're their number one advocate.
And especially you've got this little baby who needs someone to be an advocate for. So, okay.
Good thing you didn't trust me too long up there, you cuckoo for Cocoa Puffs.
You are very punchy today.
Punch country's my new baseline.
That's the end of that one. How did that go? What did you think? Any thoughts about
Curious to see where it goes. This one feels a little more lifetime. You know, this is the humanity piece of medicine more than maybe like a medical problem piece of medicine.
We'll see like what happens with this baby. Another question is what happens if there's a child who's kind of a ward of the state in the hospital and like you have to make decisions for this child is always a little tricky, and it's kind of like if a child who's now like at the best interest of the medical provider when there's not a parent there to make decisions, what does that look like? Is always a little tricky. It's tricky when they're like if there's a parent that you know exists that can't be reached is sometimes too, and then you're left with, hey, we need to do, you really can't just do tests that aren't an emergency. You can't just do interventions, like especially without like doing due diligence.
In an emergency, different.
Absolutely. If it's a
life-saving, if you save your life, then it's different. But
you could argue like, hey, when does this testing on a baby who like we don't know where the family is, like when does that become too much? I don't think they've hit that line there yet, but there's a lot of ethical things that come up with this. We're interested to see.
Again, it seems like an abandoned baby. Let's keep it safe.
This was fun. This was like kind of fun. Like, hey, what's the drama that they're building? Clearly, like not much has happened for this child yet, but like something's going to happen with this child in the season. Stay tuned with that.
All right, Didi, hey, come on now, man. Oh, how you doing, Devontae?
Fine.
Great. If you're fine, you go home.
Really?
Yeah. Hey, tell him.
Kids at the doctor.
Kids at the doctor.
Not a toddler anymore, even like young child, but like.
I don't want to sit at the doctor or wait for 30 minutes, but at least, you know, most of the time an adult can sit there and scroll on their phone or do something. But like for kids, it's a long, often, you know,
there's definitely a skill in like learning how to sit still and be calm and like learning how to be bored as a child. We are working on that with our children.
Totally.
We're not there yet. Something I will say that this dad is doing, this dad's like, hey, like trying to like hold. There's a huge part in like pediatric medicine about how do you help coach parents and care providers to like hold their children when I want to look in their ears. Like, oh, if you hug them and have them look to the side so then I can get to their ear easily. Or like, you know, how do you do these for exam purposes when you've got a kid that's all over the place? Now, this kid's a little bit older, should be able to participate with exam, but like, God bless you, parents, you're out there helping your kids get the care they need. Okay.
Me and my sister are making bracelets, and I put beads up my nose.
How many?
One on each side.
I gotta ask, why do you stick them up there? See how many will fit?
To shoot them out like rockets.
Ooh. Okay. That's,
nose rockets. What is the problem with beads in the nose? Two things. So the first would be like just obstruction of the upper airways. The, you know, interestingly, if you think about it, the nose is connected to the back of the throat back here. And then like the question is always like, hey, could that be swallowed? Best case scenario, you swallow a bead, probably no big deal as long as it's plastic, it's small, it's not gonna get stuck. Could it go and get stuck in the main airways back here? If it's just in the nose, it's like, hey, we definitely have to get that out. There's an infection risk.
Right.
Kind of clogging sinuses, other issues. And I'm going through like, hey, how are they gonna get this out?
Yeah.
I would be quick to call my ear, nose, and throat friends to say, hey,
dear
come
ENT.
look. They've got all the special little
tiny
tools.
You should see these ENT tools that they have for like the lacrimal duct and tiny little nasal kind of speculums. Sometimes we use them.
Speculums to open up and see, and then tools to get in.
Yes, which we use sometimes in ObGyn, pediatric and adolescent gynecology. We'll use some of these tools, or really stenotic cervices. I've used like a ENT lacrimal duct to dilate or things like that. Yeah.
But I breathed in, and they went deeper, and now it won't come out.
Did you try anything at home?
Yeah, I tried blowing in his mouth, but just got a little snot on my cheek.
Hey, forever, Dad.
Great thought. Hey, the mouth is connected to the back of the nose. Could you potentially blow in here? Is that worthwhile trying at home? I think the challenge is like the air is likely to go into the lungs or into the stomach more than it's to come out, but you gotta have some sort of suction up here to...
That isn't blowing into the mouth, isn't things I would have thought of to try.
We would have had the shot back out.
Stop it. Nah, we would not have.
Okay, we need to take a look with a little flashlight, okay?
Okay.
This is what I have to look forward to?
This and so much more. Red bead below the inferior turbinate.
I got a blue one. Afrin, benzocaine, cas extractor.
What do they say? They saw the red one below the inferior turbinate. The turbinates are kind of the chunky things in the middle of the nose. Again, pediatric heart doctor talking about nose stuff. And so they're able to see it right there. You know, we think about the nose out here. A lot of the nose actually kind of goes back into the face a decent way. And so, what did you say? Afrin and lidocaine? Is that what you said? So Afrin is going to help actually constrict all the blood vessels, kind of decrease some of the swelling, maybe give them some more space. And then some sort of lidocaine or some sort of novocaine, something to kind of numb things up to make this better. Seems reasonable
And
to
some
try.
kind of extractor, they said, which I think is just some tweezer type thing that's probably done. We'll see.
Also, I would call ear, nose, and throat and have them do this.
Yes.
Okay.
Yep. Dad, looks like we gotta go up and get him.
No way, he's sitting still. Oh, he'll be numbed up. You don't know this child.
Hey, Duante, you like video games?
Everybody does.
We have a 3D video game.
Shout out here to Child Life in
Life.
Children's Hospital. Like, there is a whole group of specialists in children's hospitals, children's units that specialize in child distraction, among other things, preparing and going through and managing procedures or big new diagnoses and all of those things of how do we communicate to children about the things we're going to do.
And how do we keep them busy and distracted and having fun? So this
and
sucks
meet
a
them
little less.
and meet them where they're at for their developmental stage. Like, hey, you may not be able to like convince a 3-year-old, hey, you need to sit still for this very important procedure. And so how do you do that? Definitely there's times where medications are useful, like using like medication like Versed or something that can easily just help someone feel calm and relaxed. Right. The favorite way to give that in most EDs is intranasally though. Right. So that'd be like a little, hey, how are we going to think about it? You could give it by mouth, you could give it IV. The IV works right away, by mouth takes a little bit longer. And so we always think about timing procedures with the sedation they're using.
Yeah, but they have these different ways to deliver these medications to children as opposed to a shot or some pain medication suckers or nasally or whatever. So they are thoughtful. That's a big part of pediatric medicine is.
And one of the benefits of being in a pediatric emergency department too is they're just more equipped for managing kids. Now, sometimes you have to go to any port in a storm, the nearest ED, but kind of one nice thing about being in a children's institution.
Duante, what are you doing in there, son?
I'm a rabbit, grabbing all carrots before the farmer gets me.
Keep going. This is a cat's extractor with a tiny balloon at the end. What we're gonna do is we're gonna slip it past the bead, inflate the balloon, try to pull out the bead.
Is it painful? No, he's numbed up.
Never seen this device before. Do you guys have anything like that for getting stuff out of places?
Not that I've used, no.
Okay, craziest thing you've ever had to get out of a...
I feel like that's for another OB episode.
Another OB, things that are hiding in body cavities.
Yes,
Sarah's
there is
got
a
great
different
stories.
cavity for OBGYN, you know, so
That
a
things
different...
can get placed and
correct,
stored.
different than peds, yeah.
Made it to level 3.
I'm pretty distracted.
Dad's gonna hold your head still, okay?
Look up.
Okay.
Now go back perpendicular.
I just have to say, this like gives me anxiety again that this isn't a specialist doing this when there's probably a pediatric ENT available. Like, one thing, anytime we're doing a procedure, you have to think about what is the worst thing that could happen? Could I do harm? Could I make this situation worse? And here they're trying to pass a blunt object.
Well, also, where's the
beam.
light? Like, where is... This is just, we're like blind fishing here trying to blow up a balloon above this, so this seems a little...
Now, someone can correct us and say, no, absolutely, we
That's
do this.
what
but
we do.
This, I have a hard time believing, like, A, you're not going to have a specialist do this when there's one clearly available. They're at a big pediatric
And I'd
center.
be doing something to try to open the nostril a little bit. I'd have really good lighting so I could see what I was trying to do.
This feels like a little bit like blind fishing. Yeah,
A little bit.
And there's a chance that you're going to push that bead past.
Farther back, and then
you
we
could
have
push it into a sinus, push it into the airway, and
Yeah,
make a
yeah,
bigger
yeah.
issue. Maybe that's what we're about to see. I don't know.
Below the turbinates. You guys ever hear of John O'Donohue?
No.
Been reading him a lot lately. He's got this book of blessings. And there's this one about fatherhood. Really stuck with me.
Voila, one red bead.
Got it. That's bigger than I was expecting.
Yeah.
Okay, so maybe that was helpful. I will say the things that I've seen kids swallow or put into things is like surprising. Like one time had a patient who like swallowed one of those big like 6-inch needles for hair pinning. And so like...
What?
The size of things that come out of places sometimes is a little surprising.
I can agree to that, yes.
Okay.
Yeah? How's it go?
The ending goes, may you be gentle and loving, clear and sure. May you trust in the unseen providence that has chosen you to be a family. May you stand sure on your ground and know that every grace you need will unfold before you like all the mornings of your life.
I'm still stressful about this situation, about like blind fishing for this, with a blunt object to try to get
He's
past.
sharing such a wonderful little
I'm
verse
like,
about
nervous about what's
the
happening.
universe putting families together as they're supposed to be.
Yeah, I mean,
And
I will
you're
say,
having a panic.
I'm nervous watching this. Like this just, I will say like it's so wonderful though. I was telling Sarah last night, like every time I'm in the hospital elevator with a new family bringing their baby out and they just like happen to be leaving newborn nursery, like it makes me so happy to watch new parents leaving the hospital for the first time, remembering that moment for us. And like I try to tell them like, hey, congratulations, like this is the most wonderful feeling that like for whatever reason is so common. Enjoy it.
And then 8 years later, that sweet little baby's putting
yes,
beads in their nose.
Yes.
Like it's such a
the line I tell them all is, hey, the heart is going to change, the joy will grow.
Yeah.
This is a different heart.
This is a new heart.
A new heart.
This is a new heart.
That's good. I'd add support your woman and pack good snacks.
Pack good snacks.
beautiful.
Amen.
Are the snacks for the woman or the children?
Both, obviously.
Both.
And it turns out there's no handbook for fatherhood, so I will take all the wisdom I can. Blue bead out.
2 for 2.
Red and blue.
My anxiety was unfounded.
Needless.
You think they're different flavors?
Hard to say. Way to go, team. I feel
What a
like
great job of like pediatric
Yeah.
medicine
Mhm.
to have like
Yep.
distraction and coping, and I don't know. I find one of the things that I take so much joy out of like being in situations like this is connecting with the families,
Mhm.
right? And you watch these providers talking to dad, like reassuring their child. Like
Mhm.
for me, that's one of the things that says like I could never not do my job. I could win the lottery and I just can't stop it because like how much fun is it to like help people through those trying times,
Yeah.
and to be the voice of calm amidst chaos,
Yeah.
right?
Yeah. I feel like we're gonna have to just start watching this.
The Pitt, yeah. Fun show. If you guys are big fans, let us know. Like if
Yeah.
if we need to go back and watch season 1. We
Or-
don't have a lot of TV time in our life
It's
right
just
now.
like we're watching TV during the day,
Yeah.
and it's not
Dino
Paw
Ranchers.
Patrol.
Yeah.
This is great.
Pretty realistic.
Very.
Overall, like scale of 1 to 10. Like
The characters, they're certainly, met all of these characters in real life.
Yep.
You know what I mean? Like those different personalities.
yeah. I think the only thing that's missing is like the nurse at the bedside for a lot of it. Like I just and sometimes like a nurse is caring for multiple patients, but I just feel like there's usually help. Like there's so often there's so little we can do as providers without our support staff.
Right.
Granted there were 2 people doing this procedure. It was very fine to do this without a nurse, but like always so one of the things that gets undersold in medical traumas a little bit is the role of the nurse. The charge nurse, love her.
her.
Every unit needs someone who like has like the wisdom of years and like just a little bit of snark to keep everyone in line.
Yep, and I think, we learned this early. Kurt's mom is a nurse, my sister is a nurse. You treat your nurses well. They're at the bedside, they know the patients, they keep the things moving, and so always treat your nurses well.
Anyway, so this was lots of fun. We're going to do more the Doctors Bjorkman React videos because this was fun, and
totally.
hopefully this was fun for you too.
I'm excited to see what happens with this cutie little baby in the upcoming episode.
Yeah, if there's other things you're like, hey, you guys need to watch this. You need to watch it. Let us
Send it
know.
our
Like
way. Yeah.
we don't really watch TV, and so like if there's a great
Someday.
show or something crazy that happened in the show, like let us know.
So
we'll check
fun.
it out. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.